Greetings to all of you. Thank you for your interest in learning about the Incredible Years parent programs. I am especially excited to be sharing this with nurses. I began my career as a pediatric nurse practitioner before becoming a clinical psychologist. Early on, I worked with 4 pediatricians to deliver developmental and parenting guidance to families. Over the past 4 decades, I've developed and researched parent, teacher, and child programs designed to promote children's social skills, emotion regulation, language, and school readiness skills. Today, the Incredible Years parent programs are used in over 20 countries. Across all cultures, parents share the same desire. They want the best for their children. Let me start by sharing a video of some parents talking about attending the Incredible Years parent program and the importance of parenting.
At the end of the day, we all come together to be better parents and have a positive outcome for our children's life. You think it's a good idea Horsey comes back and plays now?
También aprendí de que es muy bueno tener rutinas para los niños, explicarles lo que vas a hacer en el día. Pero cómanse la paleta primero. En la mesa, guys.
Parenting is a big issue that builds a family. A family builds a community will build a country will build a world.
Why is it so important to support parents with evidence-based programs? Globally, 12 to 25% of children aged 3 to 12 experience clinically significant social, emotional, or behavioral problems, common concerns brought to pediatricians, nurses, and other professionals. Around 7 to 10% of young children are diagnosed with conditions such as oppositional defiant disorder, conduct disorder, attention deficit disorder, anxiety, autism, or a combination. These children are at greater risk for issues like school failure, dropout, delinquency, and even substance abuse later on. Sadly, they are also more vulnerable to neglect or abuse. This graph shows worldwide patterns of aggression from birth to 30 years. You will notice an increase between 18 months and 3 years, followed by a decline. Some children, however, represented by the top red line, maintain high levels of aggression and struggle with emotional regulation. Why provide parenting support? One of the aspects of the Incredible Years programs is to help parents understand how to manage their children's aggressive and challenging behaviors, which are behavioral manifestations of emotional dysregulation. Let's watch a short video clip from the Incredible Years parent program that explains the importance of parents supporting this developmental task. Just as children's crawling, walking, talking, and toilet training are developmental steps, emotional self-regulation is a developmental, brain-based skill that is not present at birth and must be modeled, supported, and gradually taught and practiced. At first, this regulation process is scaffolded entirely by the environment, such as parents responding to a baby's distressed cries when they have a wet diaper or are hungry or want more stimulation. In toddlerhood and the preschool years, the child's emotional regulatory system starts to mature, and the burden of emotional regulation begins to shift gradually from parent to child. As children develop language skills, they become increasingly able to label their emotions, thoughts, and intentions, which helps them regulate their emotional behavioral responses. However, children still need their parents' support to help them learn how to manage and regulate their intense emotions. Emotional self-regulation is a major developmental task for preschool children ages 3 to 6 years. It is important because it allows children to be successful in school, with friends, and at home. Because children are visual thinkers and love imaginary play, it is effective to use stories, puppets, pictures, and role plays to help them practice calming thoughts, positive images, words, and behaviors. In order to remember what it is like to be a 3 to 4-year-old, let's look at a couple of children in a preschool classroom demonstrating their emotional dysregulation.
You know, I have a challenge for you. I'm wondering if somebody here can show me, when you come in from outside, how you go straight to your seat. Can somebody show me? Jimmy? Can you show me? Would you pretend, go over the door, pretend that you're coming in?
That's not how you play.
Andrew, can you show me?
You can't have two. There's no, you can't.
Can you show me?
You can't how you play it.
Just a minute, Gage. Can you?
But this isn't the same, though.
You know what? Can you take a deep breath,
You
Andrew?
can't have one. Because I don't have one. Other people have this to her.
Gage, can you tell me what the problem is? What's the problem? Why is Andrew sad?
He can't play with this. That's not how you play it. You have to give it to the other people.
I'm going to put this away for just a second. You know what? I'm going to put it away and we're going to pick it up in a few minutes. Okay?
Do these child behaviors look familiar to you? Are they normal? Yes, all young children exhibit emotionally dysregulated behavior like this. Helping parents know how to respond appropriately to these challenging behaviors can make a difference. Here is an example of something I shared in one of the Incredible Years parent programs. In the early years, children's brain and neuron connections are still under construction. The architecture of the brain is being stimulated and sculpted by the quality of their interactions and experiences with parents and caregivers. We know that 75% of the child's brain develops after birth in the first few years. Parenting strategies during this time can have a profound impact. The Incredible Years programs are designed to strengthen these early brain-building interactions. Here's a brain scan showing the impact of early neglect. The first few years are a sensitive period. Some brain connections are strengthened while others are pruned. Our programs support parents in nurturing the connections that matter the most. Early intervention can capitalize on the neuroplasticity of brain development in early life. Parents have an opportunity to strengthen a child's social, emotional, and academic growth, to interrupt cascading risk factors. A supportive and nurturing parent-child relationship enhances the resiliency of children's positive outcomes. Investing in evidence-based parent programs is not just good for families, it's smart for society. Helping even one high-risk child avoid future challenges saves significant public costs. However, sadly, the proportion of parents that ever receive an evidence-based parent program is low. What is an evidence-based program? To be classified as evidence-based, a parent program must have at least 2 peer-reviewed randomized control group trials, include at least 1 independent replication by somebody other than the developer, demonstrate change in key research-based risk factors, such as reduction in aggression or anxiety, use valid, multi-method measures, for example, independent observations of parent-child interactions and standardized measures, include a follow-up at least 1 year post-intervention to show sustainability of results. At the University of Washington School of Nursing, I've developed 14 programs for 4 decades for parents, teachers, and children to promote their social, emotional, and academic readiness. These programs are delivered in person or online, typically in small groups facilitated by professionals such as social workers, psychologists, teachers, nurses, and physicians. Today, we're focusing on the parenting programs which form the foundation of this pyramid. Our long-term goals include preventing externalizing behaviors like aggression, as well as internalizing challenges like anxiety and depression, and reducing risks for school dropout, delinquency, and substance use. I began with developing the basic program in the 1980s. Eventually, I expanded to 4 developmentally tailored programs: baby, toddler, preschool, and school age. I'm excited to tell you that in 2025, we released an updated Preschool Basic 2.0 program with new video clips that reflect culturally diverse families. I will show you some of those video clips today. Other programs include the Advanced Parent Program that was developed after my own children were born. This program covered parental interpersonal factors such as coping with anger, depression, how to build support systems, problem solving, and work collaboratively with teachers. Our Autism Parent Program was designed for parents of children ages 2 to 5 years diagnosed with autism. While each program varies slightly, they all follow the same group-based format with video vignettes and collaborative discussion at the heart of the learning experience. Incredible Years parent programs are among the most rigorously studied in the world. At the University of Washington, we've completed 9 randomized controlled treatment trials focused on children with conduct problems and attention deficit disorder, as well as 4 indicated prevention trials with high-risk populations. More than 14 randomized controlled trials have been done by independent researchers across 8 countries. 2 10-year follow-up studies have been done in the United States and in the United Kingdom. This extensive research base ensures that every update continues to reflect proven effective strategies. I am currently supporting studies evaluating our newer parent programs for children with autism with several organizations in the United States, United Kingdom, Spain, and New Zealand. If you're interested in doing research, I'd love to hear from you. I hope some of you will be inspired to join me in studying and advancing these programs. Consistent findings show reductions in child conduct problems, neglect and harsh discipline, and parental stress and depression. Also, increases in positive nurturing parenting and children's social-emotional competence and school readiness. A meta-analytic review in the Netherlands, including 50 studies, found Incredible Years programs are highly effective across diverse families and recognized them as well-established. We continue to update and add new publications on our website, incredibleyears.com. Thanks to the National Institute of Health, National Institute of Mental Health, SAMHSA, NIDA, Head Start, and the National Center for Nursing Research for making this research possible. Now, let's look at the updated Preschool Basic 2.0 version. I'm going to show you a short video clip that introduces the heart of the Incredible Years philosophy and the parenting pyramid. Welcome to the Incredible Years Preschool Basic Parenting Series. My name is Carolyn Webster-Stratton, licensed clinical psychologist, pediatric nurse practitioner, and professor emeritus at the University of Washington. I am the developer of the Incredible Years programs. For decades, I've conducted research and worked with parents and professionals around the world. I have learned so much from many parents, teachers, and children, and I'm delighted to be able to share this knowledge with you. We are always learning from our children. Indeed, I am still learning from my own 3 grandchildren. There's no magic blueprint or formula for parenting. Every situation is different, and you will want to invent your parenting style that will work best for you.
And work together, build together one big...
These are the Incredible Years. Please give yourself permission to enjoy your parenting process by trusting your instincts, learning from your blunders, laughing at your mistakes, taking time for yourself and by having fun with your children. These are the incredible years with all their tears, guilt, anger, laughter, joy, and love.
Must be nighttime.
He's not going to bed.
Oh, he's not going to bed.
The training materials for the program are designed to support group leaders every step of the way. These include a detailed manual, video vignettes, books, and handouts for both parents and children, as well as instruction. The Basic Parenting Program 2.0 is made up of 4 programs, with each one building on the one before it. The first 2 programs at the bottom of the pyramid focus on increasing positive child behaviors that parents want to see more of. The final 2 programs focus on decreasing child misbehaviors that parents would like to see less of. Parent groups meet weekly for 2 hours for 18 to 20 weeks. One-on-one coaching is also available when helpful. Program 1 focuses on child-directed play and nurturing interactions. Parents learn 4 different coaching methods and benefits of pretend and puppet play and emotional connections. Group leaders tailor content and video examples to reflect each family's goals, their child's developmental stage, and their cultural background. This toolkit illustrates many of the evidence-based parent tools discussed in the group sessions. Parents also learn the social learning principles of positive modeling, shaping, and prompting child practices, and understanding the importance of child-directed play and coaching language. Research shows these tools are powerful for strengthening the parent-child bond and encouraging positive behaviors. Let's watch part of a video vignette of a father being child-directed in his play. Group leaders will show this vignette and pause it periodically to spark discussion of the value of this approach. In this next vignette, you will see a father whose playtime involves coloring with his 5-year-old daughter, Macarini. Think about the value of this child-directed approach for his relationship with his daughter. Also notice what behaviors he is modeling in his responses to her directions and what she is learning from him.
Can you color in the volcano, this?
The volcano. Oh, what?
And this, and the bones.
What
and
colour
I'll
would you
color
like me
in
to
the
use?
Dinosaur. Purple.
What am I doing purple?
Purple up here.
Yes. So am I just doing this here?
Yep, purple up there.
Okay, then I'd love to do that.
I love your coloring.
Oh,
Pretty.
thank you.
I'll do the face.
Okay, you do the face then.
And you can do the legs.
Do the legs?
Yep.
Oh, thank you.
Is it alright if you do the legs?
Yes, I can do the legs. Is it alright if I do the legs?
Mm-hmm.
Oh, thank you. What colour should I do the legs?
Did you notice the father modeling compliance to his daughter's requests and how that resulted in her loving interactions with him?
Yes, please.
Now, let's see a mother expanding her 3-year-old's language through conversation. As you watch, think about how everyday moments can become rich opportunities to build language and connection. One effective way to build on children's interest in learning and expressing language is to describe things that are of special interest or importance to them. In the next vignette, the mother knows that Quay loves trucks. During playtime, she builds her conversation around his interest in various types of construction trucks. Think about your child's interests and what words your child would be interested and motivated to talk about.
My construction digger went away. It's backing up. Are you a digger?
Yeah.
Yeah, my construction digger went away.
When is the construction done?
Well, you're the construction manager. You tell me.
I'm the construction done. You're the bulldozer. These are the rocks.
Oh, are you finding something else for me to bulldoze?
No, we're finding some rocks. Use the bulldozer.
Oh, that's so nice.
These are some rocks.
Okay, should I bulldoze them?
Yeah.
Okay. Oh, I bumped into something. Oh, you found another one. Oh, what are you gonna dig?
I have to dig a foundation.
Okay.
After groups have viewed and discussed vignettes, such as those you just saw, there is a summary of the key points about child-directed play. Here is an example of what a summary looks like. We have discussed the benefits of child-directed play principles in terms of promoting strong parent-child attachment, as well as promoting children's independence, confidence, self-worth, cooperation, creativity, imagination, and cultural identity. These child-directed play principles include being an attentive and appreciative audience, following your child's lead and letting them teach you,
And then just
modeling cooperation,
Thank you, Nico. That was
promoting and encouraging a child's self-discovery, creativity, and independence,
this is the smallest, but
pacing at the child's level and giving the child time, using child-directed play principles with physical activities, engaging in pretend play, incorporating cultural traditions into play, supporting children with direction or scaffolding when needed to assure the child's safety and success with new learning opportunities. These child-directed principles can be used not just with toys and scheduled playtime interactions, but also in everyday interactions you're engaged in, such as gardening, cooking, doing chores, meal times, cleaning up, and bath times. As we move up the parenting pyramid, programs 3 and 4 focus on evidence-based tools shown to reduce children's challenging behaviors. This toolkit introduces effective ways to manage misbehavior, such as giving clear instructions and creating consistent routines. Parents are encouraged to select the strategies that best fit their children and personal goals. Program 3 focuses on creating predictable routines and developing healthy lifestyles, as well as effective limit setting. Some of the video clips feature interviews with parents sharing their experiences using the Incredible Years parenting tools. These reflections serve to motivate parents to use the skills they are discussing. Here is an example of a parent talking about promoting a healthy lifestyle.
In our household, our focus is on being strong and healthy. Definitely not about body image or weight or anything like that, but we talk about how do you keep your body strong and that we have to move our body every day. If we don't move our body, we're not going to keep getting stronger.
Lena, oh, I'm gonna get you, Lena. Uh-oh.
So we incorporate something active every day, and it's tough in the winter when it's dark, it's cold, but we'll try to spend at least 15 minutes doing something as a family that's movement related, whether it's a dance party or doing a little, they're great kid yoga videos and things online, just something to get them in the habit that every day I move my body to keep it strong. And same with food. We have plenty of treats, but also we try to pick some foods that help our body get strong and stay healthy. So the kids seem to relate to that concept now and actually ask about, is this healthy? Is this making me strong?
Program 4 consists of 4 parts, starting with teaching children how to self-regulate and calm down. This is followed by parents using consistent and proactive discipline approaches and teaching children how to problem solve. All the Incredible Years programs emphasize parents using tools that are developmentally appropriate for each unique child. Parents learn how to use specific parenting tools for toddlers differently from those used with preschoolers and from school-age children, focusing on the optimal ways to strengthen children's healthy brain development. Of course, screen time is one of the issues where rules and limits need to be set. Let's watch the video clip showing the introduction to promoting healthy screen time.
Coke. You like Coke?
While screens are part of today's culture, there are health benefits associated with reducing screen time, related to improved physical health, reduced obesity, fewer sleep disturbances, and more social and creative play interactions and reading. Your first step is to decide your rules about how much screen time your children can have each day. Once you have determined this limit, then be sure your children know these expectations and that you're able to follow through with monitoring their screen time use to achieve your goal.
Now it is time for electronic is done.
Group leaders would show this introduction and then pause for parents to break into small groups to discuss their screen time rules. Here is a video clip of parents setting a limit on the amount of iPad time their children are allowed to watch. Watch now how these parents give a screen time transition warning and then follow through with their command to end their children's screen time. Think about what makes their limit-setting approach effective.
Okay, 1 minute warning. We're gonna do 1 more minute, okay? And then we'll do something else.
That's my
All right.
Did you do it?
Noah, do you want to press pause?
Well, Gobble thought making the town muddy would be more fun than cleaning out.
Remember how to do it?
Did everybody?
Nice job.
Work.
Okay.
What should we do? Do you want to build a marble run?
Ooh. Or do you want to do, we were going to do motorcycles. Do you want to do the motorcycle again? With our ramp? I think Quay wants to do that.
What do you want to do?
The children we just saw seem to accept the parents' iPad limits. However, it doesn't always go so easily. Let's look at a video clip now where we discuss ways parents can respond to their children's more challenging behaviors.
Well, we don't have any juice for lunch today. I know that's...
It is normal for young children to have difficulty self-regulating and learning to calm down. They don't yet have the cognitive, language, or developmental capacity to do this on their own. Because young children are developmentally driven to explore and discover,
Nathan.
they naturally react with frustration and anger when parents set limits on their behavior. Parents can help their children to learn to manage these strong emotions by distraction, soothing, physical comfort, taking deep breaths, and positive imagery. In the next vignette, notice how the mother helps her 3-year-old son, Quay, self-regulate when he is upset because the toys are being put away. Think about what makes her approach effective.
Should we put our Magnetos away to make some room? Yeah? Okay.
Yeah.
Who's going to help me clean? Oh, nice.
You want to keep playing?
You want to keep some of them out? We can keep some of them out, but we're going to make a little room for the ramp that Noah was just running up. I think you're probably going to want to run on the ramp too.
Now look, we're not gonna all of them.
Noah's not cleaning up all of them. We can take out whatever you need too.
I need a
Can you take some? Okay, it's okay. Hold on. Okay, can we take some breaths and Mommy can help you? Can you stand up? All right.
Daddy, fix it, please.
Can you do one more?
Only down. Okay.
Okay, nice job, big
It's gonna
kid.
be more
All right,
stable.
what do you need?
I need that paper for no one is away.
It's okay. Can you take another big breath?
Then.
You tell me when you're feeling nice and calm, honey. Okay, let's find the person in here. What did the person look like?
It looks orange.
It looked orange. This one? Hooray!
The parent we just saw was successful in helping her son calm down. Sometimes calm down strategies don't work. We assess where the child is on the arc of emotional dysregulation to determine the appropriate parent response. Let's watch a video clip we used to explain this. Children will escalate their demands, arguments, and tantrums to see if they can get their parent to back down on the limits set. If you give in to your child's tantrum, then your child learns that if they tantrum long enough, they will get what they want. Your limit setting will become meaningless if you don't follow through. If your child's tantrum is not harmful to your child or others, then you can choose to respond in several ways. First, you can try prompting your child to use some calm down strategies you have previously taught them. If your prompt doesn't work to calm the child, then next you proceed to ignore the tantrum altogether to give your child space and time to calm down on their own. Wait, stay calm, and be nearby. You can model deep breathing yourself. And then, as the child calms, you can reconnect by distracting and redirecting your child to a different activity that they enjoy. Sometimes you can use a combination of these approaches. We call this the ignore, distract, and redirect approach. A discussion theme used throughout all the group sessions includes tools parents can use to manage their own anger, depression, stress, and build support networks, problem solve, and stay patient when children exhibit challenging behaviors such as yelling, hitting, and defiance. Parents are always surprised when we role play their negative thoughts and feelings and learn that they are universal. Social emotional learning is not just for children, it helps the parents too. We explore how negative thoughts triggered by child misbehavior can lead to stress and reactive parenting. Parents learn to stop these thoughts and replace them with coping statements. They learn how to respond more calmly and effectively, helping their children feel secure and supported because the parents have modeled self-regulation themselves. Parents receive handouts they use to track how their thoughts, feelings, and parenting behaviors are connected and the impact that has on their child. The Incredible Years programs are currently used in over 20 countries worldwide. This includes Europe, United Kingdom, Baltic countries, as well as the United States and Canada. Many materials have been translated into 14 different languages. Parent programs are delivered in culturally responsive ways, complementing each family's background and values. What does it mean to be culturally responsive? It means respect and affirm cultural identity and promote a culturally sensitive group atmosphere. Make culture visible and recognize its importance in relationship building and helping children develop a healthy identity. Honor each parent's goals for themselves and their children. Use puppets, toy characters, books, songs, foods, and games that reflect the diverse cultures of the families. Next, watch some parents share how the Incredible Years program supported their culture and parenting values.
In my parent group, we had people from Chinese culture, tradition, people Spanish, Latin background. So there were different other cultural groups, and I did feel it was culturally sensitive because the good parts you want to keep. I think that's what I love about the curriculum and Incredible Years, that you're able to keep, the things that you want to keep in your tradition and culture.
How you were raised is how the next generation is supposed to be raised. And I didn't want to do that because I knew how it affected me, how it affected my friends. I now have something other than what my parents taught me or what I learned from my family. As far as parenting, I'm now creating my own list of things to do.
It's not like it's taking away anything or it's replacing anything. To me, I feel like it's adding to what you already know and just giving you more tools. And I think a lot of parents, they need that. Like sometimes you just are stuck because the situations that we talked about were universal, you know, it was the same. It's like your kids are fighting, they're arguing, they're whining, they're not expressing themselves, they're just screaming, you know, and having tantrums and things. We were all experiencing that, so I felt like we had a good place, a common ground, and I think that, you know, transcends all cultures, is to be able to talk to other parents who are going through similar things and have that support. Even after the program, you know, some of the parents we recognize each other when we'd go pick up our kids and like, thank you so much for talking about such and such. I was dealing with that too.
There is also a baby program and program for parents of children with autism. The Incredible Years Baby program supports parents shortly after birth with 9 to 12 weekly sessions where babies come along. Topics include reading baby signals, cues, and temperament, speaking in parentese, providing visual, physical, and tactile stimulation to babies, learning how to baby-proof a home, supporting secure attachment, responding appropriately to crying, and building supportive networks. We discuss ways to promote babies' emotional development as well as their language and social development. We refer to the impact these parenting approaches, such as staying calm, learning babies' crying signals, playing peekaboo, singing, giving massages, monitoring and consistency of responses, using baby-led feeding, have on babies' brain development and safety. Let's watch a short video clip showing parents promoting positive attachment. By 4 to 6 months, parents and babies have established bonds of affection and are engaged in a love affair. In the next vignette, notice the effect of this father's singing on his baby's response.
Soy vecino de este mundo por un rato, y hoy coincide que también tú estás aquí. 500 pasteles no más para él. Yay. He's not very interested in music now.
Well, he's playing with his caterpillar.
Oh, now you want it.
Oh, okay.
Se llama guitarra. Guitarra.
The program for parents of children with autism is different from basic program in that there are different vignettes depicting children with autism and language delays. There is an increased focus on coaching language development, imitation, sensory routines, use of pretend play, and promoting self-regulation skills. It highlights the use of visual support schedules, choices, command, and feeling cards, and nonverbal signals. The autism program explains the ABCs of behavior change and more information on prompting and spotlighting. We explore ways parents can work to get in their children's attention spotlight, such as using pretend play, nonverbal gestures and signs, sensory games and songs, visual prompts, and intentional communication. The autism program includes a parent book, group leader manual, posters, puppets, and autism-specific video vignettes for group discussion. It is offered in a 14-week program in 2 to 3 hour sessions. These group sessions are delivered with individual tailoring of group practices according to children's language and play levels. The autism program vignettes can also be offered as a supplemental material with the Incredible Years Basic Parent Preschool program when there are parents of children with language delays and autism in the group. Let's watch a father engage his 4-year-old autistic son using play and visual prompts.
You say, I'm excited. Say, I'm excited. Well, you're really interested in these coasters, huh? The hexagons. You got 2 hexagons. 2 hexagons, now they're stacked up. They're moving together. It's like they're hexagon friends. Whoa, the hexagon is rolling. It's rolling like a ball. And fall down. Crash. Whoa, the hexagons fell off the table. Down onto the floor. Whoa, one of them came back up again, huh? Is he balancing? Looks like he's balancing. The hexagon is balancing. And it fell down.
Home coaching is available for the baby, toddler, preschool, and school-age parent programs. Home coaching is ideal for parents who can't attend groups, need makeup sessions, or require extra support, especially those referred by child welfare or facing urgent needs. 4 sessions every 2 to 3 weeks are recommended for child welfare families. Parents referred by child welfare can be started right away with home coaching model while waiting for the next group to begin. This chart shows where the Incredible Years group leaders have been trained throughout the world. Next, you will see a group leader talking about her experience leading parent groups.
I've certainly worked with families who come in feeling like they're at rock bottom with their parenting, that behaviors are completely out of control, parents feeling like they are not in control of their household anymore. And that's a really demoralizing place to start. And the beautiful thing about Incredible Years is, again, the lack of judgment, the lack of lecturing and you must do it this way, but helping people come to their own understanding.
Yeah, wow, Julia.
I think that allows for people to bring their own experience to the table, their own values, how they were parented.
And I have to do it while you do that?
Their own goals for their family and the way they want their family life to be. And we certainly see that there's an enormous night and day change just in parent outlook from before and after the program.
Over the years, I have worked with many nurses, social workers, psychologists, and pediatricians who are delivering these Incredible Years programs. You are in a powerful position to provide this frontline support in homes, schools, and clinics. I hope that today's overview has sparked your interest in being part of this rewarding work. Thank you for the work you do and for considering how you might bring this support to the families you serve. I believe parent training is the single most effective strategy to prevent abuse and neglect, reduce child behavior problems, support emotional and academic development, and foster healthier, happier families. Thank you.